Imagine a disease that quietly narrows artery in your neck, blood flow to your brain, and dramatically increasing your risk of stroke. Carotid arterial occlusive disease, a dangerous narrowing of the arteries, can silently build up without any warning signs. It affects 1 to 2% of adults over 60 years old each year, but recent biotech innovations are offering new hope.
I'm Christina Bear. Welcome to today's Business Minute.
Emerging biotech hedge fund Evergrow Biohealthcare Capital. We invest mainly in young growth biotech company that have their lead drug in the preclinical stage or early product stage because they have much more growth potential. There are new gene therapy being approved, gene editing drug, and then also innovative drugs to treat obesity, to treat diabetes, to treat liver condition, and also many novel or new drugs to treat cancer. Now, by investing in companies that are at the forefront of such innovation, we support the cause that will continue to deliver the hope and new drug and new technology that ultimately improve the quality of life for the patient.
In our binary event forecasting strategy, we have a very high success rate, over 80% success rate. And by using that, we get able to position out properly and take advantage of those opportunities.
Within 6 months, we have over 40% return. So in the coming year, there's a chance of even grow up to multiple year-fold in a very short time.
Welcome to our 50-second open mic webinar. Today, our chairman of the Medical and Scientific Advisory Committee, Dr. Van, will be presenting on our topic of carotid arterial occlusive disease. As you can appreciate, Dr. Van is a board-certified cardiologist, also a medical director of Baycare Medical Group, and we're honored to have Dr. Van present on this topic. So in this video, I will share with you a recap of what Dr. presented to our group. First, Dr. Van went into the definition of this condition and carotid arterial occlusive disease, and this is a narrowing or stenosis of the artery called carotid artery that feed into your brain.
And you see the cartoon here, when you have atherosclerosis, you can have nanobots like Mr. Anton was saying. And I think that in the future, we may have nanobots removing cholesterol plaques like this and remove them effectively, result in reduction of the stenosis that we see in this cartoon. Carotid arterial occlusive disease, as you see here, is defined as a narrowing or stenosis of carotid arteries, typically due to atherosclerosis. However, we do see some other condition that may cause this as well.
Dr. Van then discussed about the different causes of this condition, with the main cause being due to atherosclerosis.
Typically due to atherosclerosis. However, we do see some other condition that may cause this as well. As you see here, the main cause is atherosclerosis, but we may also have fibromuscular disease, and this tends to occur more in women, in female. And then we also have injury that can cause occlusion, such as dissection, resulting decreased blood flow to the brain through the carotid artery.
Dr. Van then discussed about the risk factor causing for this condition, and they include patient with a family history of the disease, patient with high blood pressure, high cholesterol, and also patient who smoke at risk for this condition.
Risk would be the genetic predisposition, such as family history, but you also have other risk factors such as high blood pressure, high cholesterol level, diabetes, tobacco usage, and of course, as trauma.
There are two types of carotid arterial occlusive disease. This condition has a very long name. One is the asymptomatic, and the other one is symptomatic. In other words, for asymptomatic, which Dr. Van will describe,
we describe as asymptomatic or symptomatic carotid arterial stenosis to classify our patient, because a lot of patients might not have any symptom or any kind of sequela, clinical sequela to the carotid stenosis. And with those, we have to treat them a little bit differently compared to patients who are symptomatic.
In terms of the effect, this condition, it can cause, of course, when the blood vessel feeding the brain is narrowing or becoming stenotic, then there would be reduction in blood flow to the brain. The patient may suffer from increase in risk of stroke or a condition called TIA, transient ischemic attack, which is a condition that usually comes before stroke. Other symptoms that the patient can experience from is a sudden feeling of weakness, numbness, and also loss of balance. In terms of diagnosis for this condition, we started out with doing the physical exam. We also then taken imaging of the carotid artery using the ultrasound, carotid artery duplex ultrasound. And then for better imaging, we would do CT angiogram or MRA, or also cerebral angiogram. Basically, we started with just physical exam, and then the simple and easily done imaging technique that is with ultrasound, and then for the evaluation of the carotid artery as well as other artery feeding the brain, then we would do what is called an angiogram. For treatment, there are several types of treatment. Number one is medical management, and this is with blood that is used to bust up the clot that can occur, and those are called a thrombolytic, and also anticoagulant as well, blood that prevent the clot from forming. We also have, for patients with severe blockage, we would also do surgery, carotid endodectomy, in which we surgically remove the blockage. Also other endovascular treatment as well. Next to last part, Dr. Van went into the new medical trend with AI to improve diagnosis as well as other biometric monitoring. Way to improve this condition is with preventative education, also public health policy, also innovation in telemedicine are all ways to improve the outcome, because it is allow us to have earlier diagnosis, improve access to care, as well as better quality of care. We also discussed about the different new medication being prescribed, and that could serve as a prospective investment in this niche. And these are like a new thrombolytic, new anticoagulant that focus on factor 11 inhibitor, a new PCSK9 inhibitor as well. Most of the companies that are innovating a solution to treat this condition are large company, but if you find smaller company that are making a potential blockbuster, you invest that on early on, then you are looking at getting 10-fold to even over 100-fold return for you in the coming years.
If you want to capture this lucrative opportunity while investing in the innovation that deliver hope to the patient, but you either don't have time or you don't have the expertise, reach out to us, contact us. We'll schedule a call to see if we are the right fit for each other.